Dr. Louie and Dr. Namani back again with the Athlete Spine. Thanks for joining us today. And as you can see, we've got a guest on us with us today. This is Dr. Chevy Iyer, who's the director of the Athlete Spine Injury Program at the Hospital for Special Surgery.
Yeah, thanks, Dr. Namani and Dr. Louie, for having me on. I'm excited to be on. I saw you guys' podcast a few weeks ago, and I was excited, and I kind of insisted that I be the first guest. So thank you for allowing me
your way
in here. Yeah, exactly.
And here you are.
Exactly.
So yeah, I mean, the Hospital for Special Surgery plays a near meaning to us. We did part of our training there. So, thanks again. And I think our topic is going to be a lot of fun today, just because with the onset of NFL training camps in this past week in Seattle, it's been big news because Chris Carson just announced his retirement due to cervical spine problems and surgery he had recently.
Yeah, you've heard us talk before about several other cervical spine injuries in athletes, and football players, unfortunately, also get a fair number of cervical injuries. And these injuries really run the gamut from really simple injuries like cervical strains to more serious things where there's problems with the cervical nerves or the cervical spinal cord. Specifically today, we're going to talk about a condition called congenital cervical stenosis. Dr. Iyer, can you tell us a little bit about that condition?
Yeah, of course. So congenital cervical stenosis, kind of like it sounds, right? Congenital means that you're born with it, and stenosis is a narrowing of something. So players with congenital cervical stenosis have a narrowing of the spinal canal in their neck, so they have less space for their spinal cord in their neck, essentially.
Yeah, and so why is this such a big problem, right? We see contact athletes with injuries all the time. What does having this narrow canal, what problem or concern does it pose?
Yeah, so when you have a narrow spinal canal, again, it means you have less space for your spinal cord. And what that means is as your body goes through its normal degenerative process, or as an athlete, if you have an injury to your neck, which happens not uncommonly, there's just less room for things to go wrong. And when there's less room for things to go wrong for the spinal cord, a relatively common injury like a disc herniation can have potentially catastrophic consequences with things like spinal cord injury, potentially even things like paralysis, paraplegia, quadriplegia, and these types of issues. And so it's a fairly serious condition when it comes to things that we treat in athletes.
You said congenital, right? So that means that these players have presumably had this from the time that they were young and playing through high school and college, right?
Yep. Yeah. And oftentimes you will see players that have had this their whole life, that have never had symptoms. And honestly, it sometimes may get picked up on a screening thing. Let's say they have some neck pain and we do an MRI to just check on their neck pain. And all of a sudden we see, oh, wow, their spinal canal is narrow. It doesn't mean they have to stop playing. It's just something that they have to know about. And it's a decision-making process that then has to go into deciding what level of risk they're willing to take on based on where they're at in their careers, how comfortable the team, their agents, their families are with them continuing their careers. But either way, it's a potentially, again, serious diagnosis that requires that detailed conversation between the player and the medical team in terms of how we want to manage it moving forward.
Yeah, and you bring up a lot of great points there. And so I think let's bring it back to the athlete, and we're sort of talking about football players today. So let's say here's a football player, never had a neck injury that they know of. They go in for a tackle, their neck gets twisted a little bit, and they get some numbness and tingling in the arm. And, that prompts an MRI. What are the concerns with that MRI? Or if that MRI comes back and they've got what we're calling congenital stenosis, what do you tell the athlete in terms of going back to play? When can they go back? Can they go back?
Yeah, so I think, Dr. Louie, in that scenario that you described, I think the key is to decide, okay, did that event that happened, was it related to just one nerve root that comes off the spinal cord, leading to some numbness and tingling in the hand? Or was what happened, even if it was temporary, if what happened was the result of more of a spinal cord issue, meaning that you were concerned that their spinal cord actually suffered an injury during this tackle or whatever it is that they were doing? Because if it's the latter, if it's the spinal cord, that really is when we start to get more worried, because these injuries can potentially have much more serious consequences and are much less likely to be reversible. So it's just something that we have to pay a lot closer attention to. If they're in the latter camp, we may not let them go back to play, versus the former. I think there's probably potentially more room for us to talk about how we return to play, et cetera.
Yeah, I think you bring up a really good point, and how I think of how I distinguish those conditions is that often if a single arm is affected, then that suggests that it's really a single nerve in the cervical spine that's being irritated or has been injured, as opposed to someone who's got both arms that are having symptoms or starting to have symptoms in their trunk or in their legs. That's when we start to think about a cervical spinal cord issue, which I agree is much more concerning.
And it's
That's
important
exactly
to remember, especially for these athletes, just because you have an injury and you see this stenosis doesn't mean you need surgery. And I don't think we're going to focus on the specific surgical procedures in today's video, but it is important to know that there are several operations that we can perform with the goal of creating more space for the spinal cord. And sometimes we have to stabilize and sometimes we don't, but not everyone needs surgery.
Yeah, in fact, Cam Chancellor, right, from the Seahawks, decided to retire with this condition, cervical congenital stenosis, and as far as we know, didn't have an operation, but chose not to continue playing football.
But he's a good example, someone that had a long, successful career, and really at every level he excelled. And it's not something that prevents you from excelling, but again, if you kind of know about it, it's important to know about it. It's a conversation that you need to have.
Yeah, so I think that's a great starter for what we're going to dive into in our upcoming videos, looking at the specific surgeries that, many football players and other contact athletes have had for this condition. But, I think that's, good for this sector today. And Dr. Iyer, thank you for joining us. Again, Dr. Chevy Iyer from the Hospital for Special Surgery, where he serves as the director of the Athlete Spine Injury Program. We were really happy to have you on with us today.
Be sure to check out his Instagram page as well, Iyer Spine MD. Until next time, be sure to like and subscribe and follow our own Instagram page. Take care, guys.
Thanks, Dr. Louie. Thanks, Dr. Mani. My pleasure to be on. I'm